Okay, everybody, welcome to our lecture tonight. I wanted to continue tonight with the theme of how much water should a average person drink. I gave a previous lecture on this a few months ago, but I thought because it's such a confusing topic, I would highlight some of the concepts that I talked about last time. So just to start off again, you have to think of water intake not alone, or fluid intake not alone, but it's a dynamic situation where we have an input and an output. It's no different than your bank account where you put money in and you spend it. So when you drink water, it doesn't just stay in your body, it actually leaves. And so it's important to understand the various inputs and outputs. And as I'll discuss in a few slides, we end up having a certain amount of water in our body at all times. It's no different than putting gas in your car and using the gas. You have a certain amount at any point in time of water inside your body. So let's first of all just look at the so-called water gain, or if you want to think about it, the input side, or if you want to think about it another way, how much money you're putting in the bank or how much gas you're putting into your car. It's all the same sort of concept. So every day from the food and the fluids that we drink, there's about 2.2 liters of fluid coming, and this doesn't have to be just water, it's total fluid coming into the body every day. And if you want to think about how much that is, that's about, if you know what a 2-liter bottle of Coca-Cola looks like, that's roughly how much, at least in this example. I'm not saying this is how much you should put into the system. It's just for this particular example, there's 2.2 liters of water coming in per day. Now, most people don't realize, and most doctors don't realize, but you also create water that you don't see. It doesn't look like water, and it's not water, let's say, in a peach or orange. It's actually water that's created in the body from certain substances that you take in with your diet. And that's about a third of a liter of water a day. And those two have to be added together so that the total would be 2.5, let's say, in a day. Now, that's the brown down here, 2.2 liters from the food, and another third of a liter that you actually generated. Now, that doesn't stay in your body permanently. We have a loss of fluid, no different than the same concept that you spend money from the money you put in, or your car uses the gas that you put into it. Well, we have a loss of water every day from our body too, and the losses occur in many places. First of all, there's loss of water all the time through your skin. This is not sweat. This is just water that you don't even see is leaving your skin every day. And we also have water that's lost from our lungs every day, and that's about almost a liter of water a day. And this is called insensible water loss because you can't really see it, but it's occurring all the time. Now, you could lose water more excessively from the skin, and that's what we call sweating. But that's not what I'm talking about here. This is baseline water loss that's occurring all the time. We also have water loss, as we all know, in our urine. That's another 1.5 liters of fluid a day. And there's a little bit of water lost in our feces. If we add all that up, we're going to end up with the total losses of skin, lungs, urine, and feces being roughly 2.5 liters a day. And that would be roughly equal to our intake, such that the intake and output are equal. We don't have any net loss or any net gain. So this is a really important slide because people have the misconception that if they drink water, somehow that is staying on board in their body permanently, even if they don't express it overtly. The sort of the subtle unconscious thought is that water intake somehow is doing something to the body permanently. It's not. The point is that the water you take in leaves your body, and I'll show that in more detail on subsequent slides. Now, one could ask the question, there is water in the body, and the water is distributed differently in different organs. For instance, it's not well known, but the brain is 75% water. The blood is 83%. You can look at all these percentages. It depends what you're talking about. As you might expect, there's less water in your bones, but it's still about 22% of the bones are made up of water. So the water is distributed in your body in different percentages in different organs. Now, you might ask the question, well, that's percentage, but how much water is there in my body? And it turns out in a man, there's about 42 liters of water in the body, and in a woman, around 30 liters. And that's a very important point, because this is a different idea than how much you drink and how much is leaving the body. In the body itself, there's a certain amount of water at any point in time, despite the fact that you're putting water into the body and water is leaving. In the steady, so-called steady state, there's a certain amount at all time, just like you have a certain amount of money in your bank, or you have a certain amount of gas in the car, despite the fact that you're putting it in and utilizing it. So this is a very important concept, because this is what we use to determine whether you're adequately hydrated or not, or whether you're so-called dehydrated or conversely overhydrated. So when you have the normal amount of water in your body, we call that hydrated adequately. If you have less than 42 liters as a male, and by less, I mean 40 or 39 liters or 38 liters, then you are what we call dehydrated. So dehydrated doesn't mean that you took in less water. Dehydrated means that you have less water in your body. So again, the bank account. Dehydrated doesn't mean that you put less money in the bank. Dehydrated means that you have less money in the bank. And those are very different concepts. Conversely, you can be overhydrated, where you have too much water in your body. And that would be in a male, like 43, 44, 45 liters. Now, these two numbers of 42 liters in a male and 30 in a female are not absolute. It depends on how big you are. So I just took an average person. For a male, we usually think of kilo, not pounds. So a 70 kilo male would be a typical size of a male. That person would have 42 liters. But if the person's 80 or 90 kilo, they would have more water in their body. So it depends on your size. These aren't absolute numbers that you should try to memorize. And that then becomes the norm. So if a male, a larger person has 50 liters of water in their body, then anything that's significantly under 50 for that person is how we define dehydrated. And anything over that significantly would be overhydrated. So the concept here is that we have a certain amount of water in our body at all times based on our size. And when we use the word dehydrated and overhydrated, we're not talking about how much we drink. We're talking about the amount of water that's actually in our body. Now, this amount of water that we have is age dependent. As you might expect, just focus on the graph on the left. The yellow is women, the blue is males. And the x-axis on the bottom here is age, and the vertical axis is the amount of water in the body. And what you can see here, as you might expect, as you age from being a baby, you're going to have more and more and more water. But the point is that after you reach a certain age, that amount of water stays pretty constant. And you can see the men aged 20 or so up to 60 or so have roughly the same amount of water in their body at any point in time, and women are the same. But as shown here, the amount of water you have actually starts to decrease as you get older. Okay, both in men and women. But in general, the amount of water, as long as you're and not growing and growing, it stays roughly the same. And the typical person's their total body size stops changing at around the age of 18 to 20, and that's why it becomes flat. Now, we have different ways of assessing how much fluid a person is drinking. Some people like to think of glasses. Some people like to think of the number of ounces. Some people like to think in the number of liters. So just for those of you that aren't familiar with interconverting, 4 glasses is 32 ounces, which is a liter. And it doesn't matter what you want to think of, just it matters what you're used to thinking of. So let's just take an example now. So again, the blue represents the amount of water in the body of a typical 70 kilo male. 42 liters of water would be in there at any point in time. And that's because we have an intake and output that are roughly equal. So if that person drinks 2 liters of water in a day, the kidney will recognize that, because the kidney is the one that determines the amount of water and changes the output. The skin and the lungs are pretty fixed. The stool's fixed. It doesn't change with your intake. It's the kidney that changes with the intake. So if you drink about 2 liters of water a day, the kidney will put out an amount such that the 2 liters total, if you include your skin and your lung losses and stool losses, will be about 2 liters a day. It's the kidney that's recognizing it. I'm not saying the kidney puts out the 2 liters. The total output, including the kidney, will be 2 liters, such that you stick at 42 liters. So here's a very nice example showing that your drinking ends up actually in the urine. Everything you drink that's above the skin and lungs and the stool loss is just going to end up in the toilet. Let's say you take an extreme example and you decided to drink 12 liters a day, which you shouldn't be doing. Your output is still going to be 12 liters and you're still going to have 42 liters in your body. You're not going to gain water. You're not going to do anything other than cause the kidney to work a lot harder and to excrete that water. Conversely, you might decide you don't want to drink that day consciously for some reason, or you might not have access to fluids. And let's say your total fluid intake was half a liter, where your kidney will shut down to the extent it can, such that your total output will be about 0.5 liters a day. Now, again, this is sort of an example that's not that accurate, because the lungs and the skin are still going to lose about 0.9 liters of water a day, which is fixed. And so even though the kidney is trying to shut down here, you're still going to end up being a little negative. So that's why it makes no sense to drink very expensive drinks. There's all sorts of voodoo and magic out there. This is the most expensive water in the world. Yeah, I think it's a Japanese water called Filico. It's over $1,000 a liter. And there are people who, think that this is going to give them great health. And all they're doing is putting this bottle into the urine every day. So it makes no sense at all to drink very expensive drinks and thinking you're doing something. As I say, everything you drink, if you have normal kidneys, is going to end up in the toilet. So it depends really comes down to how many dollars you want to spend and put that into your urine every day. And I'm not trying to be facetious, but I'm trying to make the point that there's a lot of ads out there and things, social media, that pressure you to drink all sorts of crazy things like alkaline water and oxygenated water and all these things. They just end up in the toilet. So please don't spend a ton of money on drinks that are purported to have a lot of good for your health, other than if you like the taste. That's a very separate question. Now, there are situations where the kidney cannot help to match your fluid intake, such as diseases of the liver, kidney, and heart disease. Those are situations where the kidney is not able to match your intake. And there are many patients who are drinking 2.5 liters a day, or 3 liters a day, or 4 liters a day, but the kidney can't match that, and the kidney's output is less than it should be. Well, what's going to happen? It's like putting money into the bank, but for that month you spent less. Well, you're going to end up having more money in the bank. And the same thing occurs with water. If you have situations where the kidney can't match your intake, and in this example where the output is less than it should be 2.5 liters, not 1.5 liters a day, you're going to gain a liter. Let's say this occurred over a day. So instead of having 42 liters in that person, if the kidney put out a liter less than went in, because it's just unable to do more because of these disease states. I won't talk today about why the kidney can't do it. Just take my word for it. There are disease states where the kidney can't put out sufficient urine. You're going to gain that fluid, and that's going to be manifested as usually swelling in the ankles, because the fluid tends to gather in the ankles when you've been standing all day from gravity. It's usually better in the morning. So this is a person now who's in fluid imbalance, where the input and output are not equal. That water, and in this example, the input exceeded the output, that water will stay in the body and then ends up being manifested as ankle swelling usually. If it's and it again, it depends on the severity. The more severe the gain, if let's say this was instead of 1.5 liters a day, it was half a liter a day the kidney could put out, well, that person would gain 2 liters then. The swelling would even be greater. The other thing we see with excessive fluid gain is high blood pressure, because that fluid stays in your blood vessels and raises the pressure of the blood vessels. So here's an example where we have disease states that prevent the kidney from matching the intake or the whole body intake and output being equal, and that fluid just stays in your body and will gather in your ankles usually by the end of the day, assuming you've been upright in a gravitational field. If you're an astronaut on the space station and this happens and there's no gravity, you're not going to get ankle swelling. Now, you could have the opposite occurring. You could have excessive water loss from the body, such as in people that sweat a lot, say they're running or they're in a very hot climate, or someone who's vomiting or someone who has diarrhea. All these are states of excessive water loss, and the kidney will try to cut back on its output as much as it can, but it can only cut back a certain amount. And if the loss was 4 or 5 or 6 or 7 liters, then you're going to have a loss of water in your body. In this particular example, there was negative 2 liters that day. The output from the sweating and vomiting and diarrhea exceeded the intake by 2 liters. So that would be a decrease. That's going to result in a decrease in the amount of water in the body. If it's normally 2 liters, it will drop to 40 liters from 42 liters if you were negative 2 liters. It's like you spent too much money from your bank account, and your bank account's going to have less money in it. Same sort of thing here. That is now that's what we would call dehydration. So dehydration is when there's less water in the body than there should be, and it's manifested clinically by potentially fainting because the blood pressure will drop, and that causes you to fall to the ground, or it just might be low blood pressure that the doctor notices or you notice, and there wasn't fainting. So the question is, how do you know how much fluid to drink? What is the optimal fluid intake? And there's all sorts of ads that we all know about, social media, social pressure from your friends. It's sort of folklore now that you should be drinking, 8 glasses of water a day. I can tell you that doesn't come from any evidence at all. And what you should be drinking is not based on your intellect or your mind or your brain forcing you to drink because you've been told or you read or you've heard for the last 30 years that that's something a human being should be doing. You should drink only when you're thirsty, as a general rule, not because your intellect said you should be to keep your kidneys healthy as an excuse that you hear about all the time. I got to keep my kidneys working and flowing, so I got to drink a lot. That's a bunch of bunk. There's no evidence for that at all. The kidneys work over a very wide range of fluid intake, as I mentioned. And there's no evidence at all that drinking more fluid will make your kidneys healthier, or will correct a kidney illness, or will keep them, or the fact that they work harder is better for them. That's a bunch of baloney. So you shouldn't be drinking because of that. You should drink only when your brain says I'm thirsty. The brain has what we call osmoreceptors in the hypothalamus part of the brain that sense the concentration of salt in your blood that is affected by your water intake, and only a 1% change in the so-called blood osmolality, which you can think of as the concentration of salt in your blood, makes you thirsty or not thirsty. And in general, thirst is the best way to know how much fluid to drink. If you're not thirsty, you don't need to drink. Now, there are certain situations where you can't just rely on your thirst alone. And one is in your 70s and 80s, your ability to sense thirst or experience thirst consciously can decline, not in everybody as a general rule, but in certain patients. And in that situation, you need to use your intellect and force the system to drink more than you might drink just based on your thirst alone. There are other situations, such as people with kidney stones, where the doctor will tell you to drink more to try to dilute the calcium in the urine and potentially prevent more kidney stones. And other situations, such as where you're a runner, or you're in a hot climate, or you're sweating a lot, and you don't want to simply rely on your thirst alone because you're worried that doing that might cause you to become dehydrated because you're not drinking sufficiently. That's another situation where you might want to drink more. But in general, for most humans, as a general principle, the amount of water you need to drink is answered very simply: when I'm thirsty. Not number of glasses a day, not because your friend said it's great, not because all your friends take a bottle of water to the gym and you're just copying them. It's not the reason to drink, and not certainly not to keep your kidneys healthier or to make them work more, or to try to treat a kidney disease. But drinking more water, even when I'm not thirsty, will improve my health, right? The answer is, in general, absolutely no. There's no evidence that drinking more will improve your health in any way. And as I said, people with certain conditions, like having kidney stones, may benefit from drinking more water than their thirst would signal their consciousness. In fact, we see the converse many times now, especially people who are preparing for running in a race or going to the gym. They drink too much and they get overhydrated. And many people who blame feeling ill and being dehydrated may actually be overhydrated. And so when doctors are watching runners or people at the gym, that sort of thing, they're actually looking for overhydration most of the time, because people prepare for that future exercise excessively, and then start feeling poor, let's say, and misinterpret that feeling as being, oh, I didn't drink enough. That's why I'm feeling like that. In actuality, you drank too much. And there are situations where if you drink too much, you can actually die from it. You can actually swell it. There are situations where people have had contests. The famous one on a radio station that I was involved with, where they were told to drink a ton of water in a very short period of time. People actually died. So it's not safe to drink too much using your intellect. The safest thing is to always go by your thirst. You'll never, in most situations, go wrong by doing that. So the bottom line from today's lecture is drink when you're thirsty. And I think I'll stop there and open it up to anyone who has any questions. No questions at all? Okay, thanks everybody for joining. And if any questions come to you after the talk, please feel free to email us and reach out, and I'll get back to you.
Thank you so much.
No, I had a question. Didn't you hear
Sure,
me?
sure, yeah,
Are you there?
I hear you.
Yes, I don't want to scream. Hi, Dr. Kurtz. This is Rita Martinson.
Yes.
For the last 4 or 5 years, off and on, my doctors have said I have been dehydrated, and so I don't know how much water to drink. But for the last 4 or 5 years, my lips have been chapped, and I know that if I drink about 7 or 8 glasses of water 2 days in a row, my lips aren't chapped. And when I don't drink that, my lips immediately begin to be chapped. So I've associated, the chafing of my lips with not enough water intake. Any thoughts?
Yes, in general, that's a very poor way of assessing how much water you have in your body. The best
Okay.
to assess how much water you have in your body is your blood pressure. If you have a blood pressure cuff at home,
I take it about 7 or 8 times a day.
okay, what is it?
Oh, it averages about, maybe 135, 137, sometimes 140, and then a lot of times 111.
What's the low number?
I've been working with this nurse,
Okay.
and so far they have not been able to get my blood pressure under control, really,
No,
because of the medications. I can't.
Oh, no, I'm not asking that. I'm asking, what are the two numbers? When you get your blood pressure, there are
Yes.
two numbers. One is the blood pressure just before the heart contracts.
Oh, so I'm 111, sometimes over 69, 140.
69. Okay, so the 69 is the pressure prior to the heart contracting, and the 111 or 120 is during the beat. So we always look at the two pressures. The other is your heart rate. So people that are dehydrated or volume depleted have a faster heart rate all the time because the heart's trying to beat faster to keep the blood pressure up. So we look at the baseline blood pressure and heart rate, and yours, I don't know what your heart rate is.
57, 58, 59, 60.
Are you on a medication that lowers the heart rate, or are you a runner?
I take them all, and I really don't know.
Okay, because people have that heart rate is on the lowest side, which is a good thing. The normal heart rate in someone who doesn't exercise or who is on no medication is usually in the 70s. Someone with a heart rate in the 50s, that's usually either due to the fact that you're a runner, and as you exercise and do more and more cardio, your heart rate gets lower and lower and lower, which is a good thing. You don't need to have your heart beat as often to keep your pressure what it needs to be. And then the second reason for a heart rate that you have is you're on a blood pressure pill that we call a beta blocker, which lowers the heart rate from the pill. My gut feeling is you may be on a beta blocker, but
I'm on 4 or 5 pills, actually.
right, but one of them
Oh, I see. Okay.
is a so-called beta blocker, most likely, for your heart rate to be there. Now, as far as, and it makes it harder to use the blood pressure to assess hydration if you're on blood pressure pills. But in general, if you weren't on blood pressure pills, if you're dehydrated or volume depleted, your baseline blood pressure is low, your heart rate is high, and when you stand up, the blood pressure drops excessively. Those are the things that we look at, not your lips being chafed,
Right.
assess hydration. Another thing we look at is the vein in your neck. It's called the jugular vein. And people that are dehydrated, the pulse in that vein is low. It's below the clavicle. So a doctor could look at that and assess that. Generally, when the lips are like that, that's a local issue with your lips. It has nothing to do with the amount of water you have in your body. Another way we assess whether you're dehydrated or not, which again is how much water do you have in your body? That's what we're talking about. Like how much money is by your weight. Since 60% of your weight is water, a very easy way to assess how much water you have in your body is by just weighing yourself. The day-to-day changes in weight are due to water, not fat. The more chronic changes in weight from week to week or month to month are you can get fat or lose fat or muscle. You can lose muscle mass too. But the day-to-day changes in weight are just from water. So if your weight goes up a pound or drops a pound, it just, you put more water into the system than you got rid of that day, that kind of thing. So if your weight has been roughly constant, is the bottom line, then you're not getting hydrated, overhydrated, or dehydrated. If you weigh, I don't know what you weigh, but if let's say you weigh 120 pounds today.
Let's say plenty.
Okay. Well, let's say you weigh 120.
Plenty, yes.
We won't go further than that, but let's just say you weigh 120 today and tomorrow 121, the next day 119, and the next day 120. If it fluctuates a pound or two, average, if you just look at the whole average from day to day to day, if it's roughly the same, you're not getting dehydrated or overhydrated.
Well, I took all my blood tests and the nephrologist said, you need to drink more water. What do you think that means then?
I'm not sure why, without knowing.
Okay, because you know this nephrologist, that's what he said to me.
I can talk to you offline if you'd like to go into more detail. In addition to what I said about the blood pressure measurements and the heart rate and the jugular vein in the neck, that's sort of the overt way by examining you to see whether you are dehydrated or overhydrated. We can also do blood tests, and there's certain blood tests that give us a clue that you're dehydrated or overhydrated. And I don't know what those are with you, but I can go over those with you. But in general, having changes in your lips has nothing to do with being dehydrated or overhydrated. That's a local issue, with your skin.
So there's a correlation, but not causation, but they're definitely correlated somehow. I mean, I've been charting this for years.
Yeah.
Because I didn't believe it either. I mean, I didn't come to this lightly. That's what I'm saying.
Well, I can go over, things with discuss, but just change whether you're fat or not has nothing to do with, even though a lot of people say it does, but there's no experimental evidence at all to suggest that changes in your lips are due to change in water intake. The water, and in fact, if you do the math, and I can talk to you about that offline, the amount of water that you drink that actually goes into your lips is such a tiny, tiny fraction of the total. It would almost be mathematically impossible for drinking water to affect local water in your lips. It's just not a physiological possibility, but we can talk about that offline.
Right. Thank you.
Hi, doctor. A couple of questions. Number one, would the formula change very much with an individual that has only one kidney? And number two, is there a substitute for water? In other words, when you talk about the quantity of water, does coffee count? Does a bowl of soup count?
So two excellent questions. First, having one kidney instead of two. In general, in a healthy person, if you lost a kidney, let's say you donated a kidney to somebody, immediately your kidney function drops in half. However, if you follow that person out over the next year, the remaining kidney starts to grow and grow and grow, and it will take over about 80 to, if you're a younger person, it depends when the kidney function was lost on the other side. But if you do that experiment sort of in the ideal situation, younger person lost one kidney suddenly, and now you do the experiment of following the total kidney function. Initially, it's 50%, as I mentioned, but if you follow the kidney function over time, the total kidney function actually increases, not quite to what it was before, but close to it, because the remaining kidney increases and increases its function in and of itself, and closely over time starts to replace, almost, not quite, the function of the two kidneys. That's in part due to the fact that it grows, the cells get bigger, and also each part of the kidney functions more than it did before. And you can actually see the kidney getting bigger on x-rays. So now let's take the extreme where the remaining kidney did not increase for some reason. Can you still drink the same amount? And the answer is yes, because even if you have 50% of your kidney function, let's say you have what's called CKD, chronic kidney disease for whatever reason, or you didn't have it, but you donated a kidney and your kidney didn't get bigger and you stayed at 50%. 50% of kidney function is still way more than sufficient to get rid of the 2, 3, 4, or 5 liters of water intake. Now, you may not be able to get rid of 12 liters, like having 2 kidneys, but you certainly can handle the range of water intakes that an average person would put into themselves, which is, it varies from 2, 3 to 4, maybe at the extreme 5 liters of water a day. But that would be a high intake for most people. So yes, one kidney can handle it, unless if that's assuming the one kidney is functioning at 50%. If that one kidney is functioning at 20% of normal or 30% of normal, that's when you could be started getting into having to cut back on your, or at least not cut back below the 2, 3 liters, but not want to go much above that. So it really depends on the state of the remaining kidney. Did it increase to function almost like 2 kidneys? Was it somewhere in between where it increased by 30% above its original? Did it stay at the 50%? Or is it actually diseased and that remaining kidney is less than half your renal function? So it really depends how much renal function you have with that one kidney, to answer your question precisely.
Thank you.
No, I didn't answer the second part. So you asked,
Right.
which is an important one also, and that is, when I talk about intake, am I talking about only water? And I'm not. I'm talking about coffee, tea, soup, water that's in your fruit, pure water, soft drinks. It's the total fluid intake. The body doesn't care what the source of the fluid was. There's nothing unique about drinking water versus drinking coffee or tea as far as fluid intake, water intake. Body recognizes the water that's in all, or the kidney recognizes the water that's in all different substances and gets rid of the water that was in them. So medically, it doesn't matter. It's totally partitioned into all these different.
That's even though some people say coffee is dehydrated.
Right, and that was on one of my slides. I actually it out because I didn't want to have too many slides. That's not true. That's an old tale that's been passed down from generation to generation.
Wow. Thank you.
I have a quick,
Go ahead, Tony.
yeah, this is Tony Garcia. I am a multiple myeloma patient who luckily is in remission, but because of my myeloma, I have chronic kidney disease, stage 3.
Yes.
And my therapy has been advised to drink 2 liters of water a day.
Yes, you'll hear that from most MDs. That doesn't come from any data. It's just sort of a generic, sort of nice thought. It really depends on what your GFR is. Again, until your GFR gets down, GFR for glomerular filtration rate.
Yeah.
Glomerular, for those that aren't familiar with it, is refers to the filtering unit. Each of our kidney has 1 million filters, little tiny filters that you can't see. And the glomerular filtration rate refers to the amount of fluid that the total number of filters that we have in our kidneys can filter per day. And normally it's about 120 or 130 liters. It's a ton of fluid are filtered by all these filters. And as the function of those filters decreases, either because the filter got plugged or the pipe coming out of the filters got blocked, which is likely in your case in multiple myeloma. There's proteins that build up in the blood that can clog the tubes that come out of the filters. So it's a little bit complicated. Sometimes the filters themselves in multiple myeloma can be affected. But be that as it may, the total filtration, if it decreases, you get into what's called CKD, and it's been divided up into different stages just based on what the filtration rate is. So it depends what your filtration rate is. As your filtration rate decreases, you're fine until you get down to about 30% or 20% of the normal 130 liters a day. When it gets down to that range, you have to start worrying about retaining fluid. So the doctor can sometimes give you sort of an approach to say, drink 2 liters a day, either because they don't want you to drink more than 2 liters a day because you'll get overhydrated because your kidney can't put out more than that, or they'll say drink 2 liters a day just because they want to maintain some kidney function, which again, as I said, has no experimental basis per se. If they said 2 liters a day because they're worrying about you drinking too much, that does make sense, because if assuming that the 2 liters is correct, I'm not saying that's a correct number. I'm just saying they may be giving you that as a maximum limit, not to go above that, so you don't get overhydrated, start getting fluid in your legs, raising your blood pressure. That would make some sense, potentially. I'm not saying it does in your case. But if they're saying drink 2 liters a day just to keep your kidneys healthy, there's no experimental evidence for that.
All right, no, because I'm stage 3. I'm a moderate level on the GFR.
Right. Again, it depends.
Yeah, and it's been consistent now since I started the therapy.
Right. All I'm saying is if your GFR is in the 30s, I don't know what it is, 30, 35, whatever it is.
50 to 60.
Well, if it's that good, you can drink whatever you want, basically.
Oh, good. The only downside is I make many trips to the bathroom.
Yes, so that's a separate issue, as I always say, as sort of as a joke, but it's true. People in their 60s get up, once to pee at night. People in their 70s twice. People in their 80s 3 times. In your 90s, you're up all night. You're not sleeping. So, as you age, it makes more sense to stop drinking as much at night. If you really want to, if it really is affecting your sleeping, or at least psychologically, you're bothered by getting up. Some people get up, they go back to sleep, they couldn't care less. But if it does bother you to get up as often, then cut back on your fluid intake in the evening and do your drinking, before dinner if possible. Drink as little as you can in the evening, and it'll cut back at least to some extent having to get up to go to the bathroom at night in many people. Other people are taking diuretics for blood pressure. That you can try to do in the morning. taking the diuretic in the evening. So there are things you can do to modify both your fluid intake and the timing of your pills to some extent. It's not an answer for all people. But
Very good.
getting up at night and going to the bathroom doesn't mean that having to go to the bathroom will wake you up.
Good, I'm on.
Many people in their 70s and 80s get up just because they wake up and then they go, oh, I'm up, I might as well go to the bathroom. So the chicken and the egg can vary depending on the person.
Very good.
Dr. Kurt, my husband has been dealing with very low sodium, and the nephrologist put him on a restricted water diet. He used to drink like 10 glasses of water a day. So he said, now you're gonna take, probably more, because I was not counting the coffee and the glass of wine that he drinks and the milk. So it was probably, he was drinking at least 12 glasses a day. But the nephrologist put him on a restricted diet, he said, including any other liquid, whether it's coffee, soup, or wine, no more than 5.5 glasses. The next time, this was about six to 8 months ago. The next time we went, he gave up again the blood test. And he said his sodium has improved. However, his creatinine is worst. So what can we do now?
Yes, so just to back up a little bit, just to put it in perspective, if your kidneys are normal, you can drink as many glasses, as I said before, up to 12 liters of water a day, and your sodium, your kidney will put out that water, and your blood volume won't expand. You mentioned sodium in the blood. I didn't talk about that. So for those that aren't familiar with it, in the blood, there's a certain concentration of salt, sodium chloride, and we look at the sodium part of the sodium chloride. If you retain water, that concentration can drop. You dilute the sodium in the blood, and in addition to your weight, we use that as a reflection of how much overhydration you have in your body. As you get more and more overhydrated, the sodium concentration drops. Now, you mentioned the amount of water your husband was taking. My first question to you, which you sort of answered, was his kidneys cannot be normal, because the amount of water that you're talking about should not have dropped his serum sodium. He should have been able to get rid of that water, and his sodium concentration would be normal. So the fact that he's drinking that amount, and not just drinking, total fluid, as I mentioned, and you mentioned, it's not just water, it's coffee, tea, soup, all the fluid coming in. The fact that his sodium concentration is dropping on that amount suggests he's got a kidney problem to begin with, because a normal kidney could handle that and you wouldn't get overhydrated. So that's one thing. So if in that particular situation, that tells us, without even knowing anything, that his kidney cannot handle a normal amount of water intake. And the only way around that is to cut back if you want to correct the sodium. So the first question is, should the sodium concentration in the blood be corrected? Now, some doctors get very intense about it. Others say, well, it depends on how much the sodium dropped. So we can accept a certain dilution of the sodium and not make the patient crazy by restricting them excessively, because that has its own effects. It decreases the pleasure of living, the pleasure of drinking, and that different things and that sort of thing. So just restricting diet in general is something MDs should think about much more carefully than they do. But putting that aside, assuming that the sodium dropped to a point that it needs to be fixed, and I'm saying that's not necessarily a fact. Some doctors get very worried about it when others don't. But in general, let's assume that you had to get worried about it here. I'm not saying it's true in your husband's case, but let's say all doctors would agree we need to do something. Yes, the answer is to cut back on the total fluid intake, not necessarily water, just cutting back so that the total, whether it's water, coffee, tea, it doesn't matter. They all add up together. That intake, that amount coming into the body, if it's decreased, will raise the sodium to a certain extent again. The problem with doing that is if you do that in certain patients with kidney disease, yes, you correct the sodium, but now the kidney isn't getting perfused like it was before, and the kidney function can decrease. So there's sort of a fight between correcting the sodium and making the kidney function worse, and the doctor has to make that decision. And so oftentimes we opt for keeping the kidney function healthier and relaxing the fluid restriction. And yes, that might mean that the sodium is going to drop more, but it's a toss-up. You have to choose one or the other. They're opposing things. If you liberalize the fluid intake, the kidney function will be better, but now the sodium in the blood will drop. If you restrict the fluid intake, the sodium concentration will get better, but now the kidney function gets worse. So, a good doctor assesses both, knows that they're opposing effects, and will try to, get a certain intake that will sort of be a happy medium for both. So I don't know if that answers your question, but there's nothing that can correct both. They're opposing things. If you restrict the fluid too much to help the sodium, the kidney function is going to get worse. If you liberalize the fluid too much, the kidney function will get better and be fine, but the sodium will now drop. So you try to pick something in between. Now it makes it harder for patients because they don't know, they're not measuring these things on a daily basis. They don't know what their intake is doing to both. So you have to basically just sort of keep the intake roughly the same, and the doctor then assesses things, and then not change the intake too much, from day to day, because then both are going to be bouncing up and down. So it really requires very frequent monitoring. When we first change intakes, we like to get the sodium and the kidney function every couple of weeks. So blood work every couple of weeks till we figure out exactly where we are and can, make a predictable recommendation to the patient to, say, okay, this is your total fluid intake, plus or minus 10%, 15% in a day. And again, you can tell from the weight. As his sodium drops, his weight should be going up. So if he's taking in too much fluid such that his sodium will be dropping, even though that's good for the kidney, his weight will be going up from day to day. Whereas when he's restricting his fluid intake, his weight should be, stabilizing. So the weight, getting the weight every day after you've gone to the bathroom without clothes is not only a good way to assess your fluid balance for a patient like your husband, but for all of us. Everybody should know what their weight is from day to day. Just like your blood pressure. It's something,
Could I talk to you offline after we've finished?
Sure, please.
Thank you.
Just reach out to Leslie and we'll set up a time to talk.
Thank you so much.
Sure. Any other questions?
Yeah, I have one. I enjoy going hiking, and I have been bad, I guess, that I wait till I am thirsty to drink. And it sounds like, from what I hear, that I'm dehydrated by the time that happens. But the other thing I wanted to ask is, I notice if I've been hiking long enough, it seems my pants begin slipping off. Is losing enough water weight enough to make them slip off?
Okay, I just want to make sure I understand the first part of your question. When you hike, you're saying you're going by your thirst to know when to drink. You don't drink ahead of time.
Right.
What were you saying coupled to that why that's a problem? I didn't catch that.
Well, it sounds like I'm dehydrated by the time I actually do drink.
What? Yeah, that's the part I didn't catch. Why are you saying that? But what is that based on?
Seems like a lot of people have said that.
Oh, I see. No, what I'm saying is you're doing the right thing. Unless you have excessive sweat and you're worried about your thirst not being reliable, either because of your age or because of other conditions you have. But in general, if you're hiking and you don't have excessive sweating, I'm not saying you in particular, but I'm saying in general, with this hike, there's not excessive sweating, just a lot of exercise with maybe a little more fluid loss than you're not going to get dehydrated if you rely on your thirst. So no, what I'm saying is you're doing the right thing.
Does it matter that I'm 69?
I would say if you're 69 and you've been relying on your thirst till now and your blood pressure's fine, your kidney function's fine, and you're healthy, then you can trust your thirst. I only wanted to bring up the thirst being an issue for a small minority of people in their 70s and 80s, but in general, the thirst mechanism in people in their 60s, 70s, and 80s is perfectly fine. So in general, unless you're a marathon runner or you have excessive sweating that is going to occur, and you want to be a little more careful than simply relying on your thirst, in that situation you can take fluids beforehand. But because of people even doing that, what physicians who deal with marathon runners and athletes are seeing is not dehydration. They're seeing people drinking too much in those situations and getting into trouble because of the overhydration. So just do what you're doing, and you shouldn't, because of what people are telling you, think you're getting dehydrated. There's no evidence for that based on what I'm hearing from what you're saying. Now, as far as the pants changing, is that you're talking about after a number of hikes or after one hike?
Just after a long hike, as I continue going, seems like I have to tighten my belt a notch so they won't slip off.
Yeah, I mean, if you lost that much fluid as a cause of tightening the belt, your weight would be down, you would be lightheaded, you would be feeling like you're going to faint. I mean, there is no way from a hike where your blood pressure was the same, or after the hike your weight is the same. Again, the weight is a great thing to know whether you lost weight, lost water excessively. You weigh yourself before and after an event or from day to day. I mean, that's remember, you're 65% water, and your day-to-day changes in weight or after an event like you're talking about are due to water loss or gain. And so if your weights are roughly the same, the amount of water in your body's the same. You're not overhydrated or dehydrated. It's the best thing to do. And we do that in the hospital. We weigh people's weight, or people are coming in for dialysis. Let's say I'll give you an example. We have a patient who we're dialyzing. They don't make urine. Everything they drink stays in their body. So to know how much fluid we have to remove, we just weigh them. So if they haven't been in for dialysis for 2 days, and we know after the last dialysis they weighed 70 pounds, and now they come in 2 days later and they weigh 73, we have to remove 3 pounds of water. So doctors use weight as a surrogate for whether you're dehydrated or overhydrated. If your weight's the same, you have the same amount of water in your body, you're neither dehydrated or overhydrated. And that, and the blood pressure, if your blood pressure is the same as it was before and your weight's the same as it was before, the amount of water in your body is the same as it's always been. You're neither overhydrated or dehydrated. It's the best thing to follow.
What if on the next day I'm drinking and drinking and drinking? Does that mean I was dehydrated?
No, the drinking and drinking and drinking, the thirst would occur immediately. Doesn't it? It's from second to second, the thirst is being sensed by your brain. There's no delay and then it occurs the next day. It's a second to second sensation driven by the sensor in your hypothalamus that tells you how much to drink. It doesn't stop working and then all of a sudden work the next day. It's giving you updated information immediately on a second to second basis.
Okay, thank you.
Any other questions at all? Okay, everybody.
Thank you.
Thank you for listening. And again, if you have any questions or anything you're worried about, please feel free to reach out and I'd be glad to talk to you offline.
Thank you, doctor.
Thank you.